Okay, this is how to use this YouTube channel. And first of all, what are the goals of the channel? Most of you know this already, but obviously a lot of people are interested in health. Oops, my book's falling off the table. But also, I've been interested in academic skills, culture, history for a long time. And as far as nutrition, I think nutrition and toxicology go hand in hand. There's a lot of toxins in food one needs to be aware of. In addition, I've been rather shocked to read the medical textbooks. They're routinely 50 to 100 years out of date. So in a sense, I try to correct the textbooks when I'm on those topics. I also have noticed a lot of people, they go through their college pretty quick, and there's a lot of great artists, musicians, and scholars who are worth knowing about. So I try to celebrate them with this YouTube channel. Whatever seems good and relevant, it'll get posted on this channel. I also believe, high schools, grade schools and high schools, they don't teach study skills. And study skills make a dramatic differences in a person's academic ability. So I talk about those occasionally. Some of the things that have come up a lot with viewer questions is to recognize there's a lot of videos on this channel. There's 406 videos already. So what I'm saying is if you just go to the little, magnifying glass thing and you click on that for search, if you search like diabetes, hypertension, or any of these, common diseases, there's a good chance you'll find something on this site. So check that out. Things like people ask about leaky gut, cancer, all kinds of subjects. That will be worth doing. You'd be surprised how many things have been posted on this site over the last couple of years. When people ask questions, I try to answer most of them. Video recommendations, if you recommend something, I'll consider it. I don't know for sure if I'll do it, if I got time, or if I'm interested, but I'll certainly give it a serious consideration. Another thing, too, is some people, from the lectures, they want to use this academic material for their own study, maybe for their own talks at their own places. You just hit the print screen button, and you can get a copy of it, of one of my drawings or something. And you're welcome to use them. I would like you to, mention that you got it from me, but you're welcome to use them. I mean, this is for education. I want you to have the benefit of it. Also, I do have videos at other sites. YouTube is my main site. It's sort of convenient. Everything works. I'm used to doing it. But I do post some stuff at all these other video sites and whatnot. So these are other places you could find me if you want to, or send me a message if you want to. I just do this channel as a hobby. And I had some people criticize me, say, oh, well, you just do it as a hobby. You'll never have that good a channel. But my attitude is, doing it as a hobby, I think it actually helps in some ways. I'm not trying to sell anything, so I don't have to promote any products. I'm not trapped into one point of view. Like I said, if you're a cardiologist, you cannot criticize stenting. That's what cardiologists do. Whereas I really don't care. I mean, I just talk about atherosclerosis to understand it and avoid it. I don't have any financial angle to care about one food. No, there's nobody who sponsors me, so I can just tell the truth as I'm best able to see it. And these are questions that I want to answer for myself to understand what is the role of carbohydrates, protein, and lipid in health and risk for all these diseases and cancer and all that. So that's what it's about. And just the main purpose of this video is to let people know there's over 400 videos, and if you search, you'll find a lot of stuff. And that print screen feature, a couple of people have been pretty happy with that as a way to, have these drawings for their own study purposes. You can make your own file. Like, let's say, you personally had a disease, or someone in your family had a disease, you want to help them. That'd be a good thing to do. Search all the relevant internet videos, read the relevant books, and then you'll be very well informed. It's not uncommon when, an educated, motivated person, they can know their disease better than a doctor does. It depends on what it is. A doctor who's a surgeon is going to know surgery better than somebody who hasn't done surgery. But you can really become a pretty good expert on something by watching all the different videos and reading about it, talking to people, and accumulating the information. So anyways, hope that helps.